medical power remained equal until the turn of the century. Then, new medical treatments emerged that were potentially very profitable. The AMA joined with strong financial forces to transform medicine into an industry. The fortunes of Carnegie, Morgan, and Rockefeller financed surgery, radiation, and synthetic drugs. They were to become the economic foundations of the new medical economy.
The takeover of the medical industry was accomplished by the takeover of the medical schools. Well, the people that we're talking about, Rockefeller and Carnegie in particular, came to the picture and said, we will put up money. They offered tremendous amounts of money to the schools that would agree to cooperate with them. The donors said to the schools, we're giving you all this money. Now, would it be too much to ask if we could put some of our people on your board of directors to see that our money is being spent wisely? Almost overnight, all of the major universities received large grants from these sources and also accepted 1, 2, or 3 of these people that I mentioned on their board of directors, and the schools literally were taken over by the financial interests that put up the money. Now, what happened as a result of that is that the schools did receive an infusion of money. They were able to build new buildings. They were able to add expensive equipment to their laboratories. They were able to hire top-notch teachers. But at the same time as doing that, they skewed the whole thing in the direction of pharmaceutical drugs. That was the efficiency in philanthropy. The doctors from that point forward in history would be taught pharmaceutical drugs. All of the great teaching institutions in America were captured by the pharmaceutical interests in this fashion. And it's amazing how little money it really took to do it.
Surgery became viable with anesthesia and infection control, and doctors advocated expensive, radical operations. These in turn produced the need for a large, lucrative hospital system. Radium fever swept medicine. The price of radium rose 1,000% almost overnight. Another costly technological industry entered the hospital system. A drug industry grew out of the booming patent medicine business. The doctors changed educational standards and licensing regulations to exclude the empirics. Soon, only AMA-approved doctors could legally practice medicine. In a brief 20 years, the AMA came to dominate medical practice. Organized Medicine launched a media campaign to associate the empirics with quacks. The code word for competition was quackery.
So now the average doctor goes through school. He gets a great education. He has to be really smart to get through it. He learns all about drugs. He doesn't know too much about basic nutrition. I found that the average wife of these physicians knows more about nutrition than he does, but they sure know their drugs. And if you go to your typical doctor today, I don't care what it is, chances are you're going to walk out of there with a prescription. Why? Because that's what he has been trained to do.
It's claimed that the only way to get a so-called virus was to be injected with it. It's understood that all viruses are non-living, dead protein structures. Argenus's theory was that they are all naturally occurring in the body and perform a special role of being able to dissolve toxic or dead tissue from the body in order to heal.
How many people know that viruses aren't alive? It's been known in the medical profession for years that you don't give antibiotics for a virus because they're ineffectual, because they're not alive. They have no nucleus. They are protein parts. There's no respiration. There's no functionality. There's no glandular activity. They are not alive. But what are they? They are soaps. They are solvents. The body makes them to dissolve tissue in your body that are too toxic for the parasites, the bacteria, and the fungus to eat. Too toxic, like when I had chemo, radiation. Parasite, bacteria, fungus tried to eat into that dead tissue, they were killed because they were poisoned to death.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died. Experts agree unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere.
The mission of the Pandemic Emergency Board is to provide recommendations to deal with the major global challenges arising in response to an unfolding pandemic. The board is comprised of highly experienced leaders from business, public health, and civil society.
We could be looking at double the number of cases in 1 week and 16 times as many in a month if we are not able to stop the spread. That would be on the order of 500,000 cases, and it would continue to rise exponentially. In 3 months, we could be approaching 10 million cases.
We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
I am concerned about what we saw over the weekend on cable news. A lot of legacy pundits talking about.
Dr. Amesh Adalja is a senior scholar at the Johns Hopkins University Center for Health.
Dr. Tom Inglesby is the director of Johns Hopkins Center for Health Security and joins us now. Doctor, thank you so much.
Good to be here.
Well, there seems to be at least some degree of spread within the community in Wuhan and other parts of China.
How they're preparing for the possibility of the virus here in Maryland.
Inside the biocontainment unit at the Johns Hopkins Hospital, it takes high boot covers, surgical gowns, and portable respirators, all to minimize the contamination.
Welcome to this special briefing from the Johns Hopkins University of Medicine. Thank you all so much for joining us. I'm Lauren Sauer, the Director of Operations for the Johns Hopkins Office of Critical Event Preparedness and Response. Today we're here to talk about the outbreak of 2019 novel coronavirus, known as COVID-19, with 5 Johns Hopkins experts.
Before they're released out into the population, that they're free of this virus.
Yeah, so many of the measures that have been tried to control this virus have been the appropriate one. I will say that
as the debate intensifies about how long to continue the coronavirus lockdown in this country, we want to bring in one of the nation's top experts on infectious disease epidemics. Joining us from Baltimore, Dr. Thomas Inglesby, director of the Center for Health Security at Johns Hopkins University. Doctor, let's start with the astonishing spread of this virus. 1 week ago, we had 25,000 cases.
What is the consensus among the medical community about the severity of this particular coronavirus?
Well, I think most of us believe that this is a pretty significant concern. We don't yet know.
So now I turn to a couple of doctors at the front line of this coronavirus fight. Joining me now is Dr. Megan Ranney, an emergency room physician and associate professor of emergency medicine at Brown University.
Dr. David Ho, it's good to be with you, and thanks for joining the show.
It's my real pleasure. Good to see you again.
How big of a problem was it not to have testing?
It's huge. Without the tests, basically the healthcare system is operating blind.
Our next guest is known as a master virus hunter. Dr. W. Ian Lipkin is an infectious disease expert at Columbia University, and he's fresh out of quarantine after traveling to China, where he was studying the coronavirus outbreak.
2 prominent doctors in Atlanta say at least 9 physicians in the city, 9 doctors have COVID-19. They expect more cases for healthcare workers. Dr. Carlos Del Rio is the chair of the Global Health Department at Emory University and the dean overseeing all physicians at Grady Memorial Hospital. Dr. Sanjay Gupta is a neurosurgeon at both Emory and Grady hospitals, as well as the chief medical correspondent for CNN.
Joining us now, director of the Harvard Global Health Institute, Dr. Ashish Shah. He is a practicing physician, also professor of medicine at Harvard Medical School. Welcome back to the show. Great to have you back on. Dr.
How is testing going? And I gather Stanford was among the first to have developed its own kind of sort of in-house test for this.
We developed a so-called RT-PCR test
that when the
UC Davis Medical Center is one of 3 research hospitals here in California taking part in a clinical trial to find treatments for the coronavirus.
Yeah, pretty encouraging here. UC Davis, UC Irvine, and UC San Diego Medical Center all working with the federal government to figure out if an experimental drug can help treat the virus. The drug is an antiviral treatment that has been fairly effective against SARS and other viruses.
Okay, Elizabeth, thank you. I know there's so many questions on testing. Let me bring in this doctor, Dr. Myron Cohen. He's director of the Institute for Global Health and Infectious Diseases at the University of North Carolina at Chapel Hill. So, Dr. Cohen, thank you so much for joining me.
So here to help us understand coronavirus is Dr. Michelle Barron. She's the medical director for infection control and prevention at the University of Colorado Hospital at the Anschutz Medical Campus. So,
for more on the fight against the coronavirus in the U.S., let's welcome Michael Osterholm. He is director of the University of Minnesota Center for Infectious Disease Research and Policy, and thank you for joining us. We've been
So what's it like to actually have the coronavirus and undergo treatment for it? Carl Goldman is a patient at the country's only federal quarantine unit located at the University of Nebraska Medical Center. He's joining us. Also joining us from Omaha is Dr. Mark Rupp, an infectious...
Virus is unforgiving. It spreads before you even know you've caught it. And it tricks you into believing that it's nothing more than a little influenza.
Hospitals are under your remit, and what is the equipment situation in those hospitals?
Well, thanks for having me, Andrea. We have 6 hospitals in our system and an additional site that functions as our rehabilitation and hospice center. The situation with our...
So what we're seeing, we're at the University of Pittsburgh Center for Vaccine Research. This is the same place where Dr. Salk developed and produced the polio vaccine back in the 1950s, and they've done an amazing work here at getting vaccines throughout the decades since. They're specifically working
feet away and just talking to somebody and catch it. You can catch it. You know how long it can live on surfaces. So things that nobody even thought of, the level of contagion. In addition to our courageous doctors, nurses, and healthcare workers, so contagious. You can be feet away and just talking to somebody and catch it.
This is pure mockery. I keep saying is, those nurses and doctors are the most stupid people on earth. Look at them.
In addition to our courageous doctors, nurses, and healthcare workers.
So not one step forward and say, well, there is nothing to do in the hospital, so we have time for a little dance. Don't you have some work to do, imbeciles?
So contagious. You can be feet away and just talking to somebody and catch it.
I think they need to be shot or something. You're the ones spreading those germs around in the hospital. So now you're going to visit my grandmother. Well, this piece of shit here breathed all over you. And they all have a big smile. Like happy gays. Posted April 2, April 2nd. So this takes maybe an hour or 2 hours practice. So you have time for this bullshit. Don't you have to take care for all the corona patients?